Assalamualaikum everyone, welcome to my channel Med Easy with Nas. If you are a medical student looking for simple explanation, helpful study content, make sure to subscribe and join this learning journey with me. Let's make medicine easy together. So our next topic is privileged communication. So by definition, privileged communication is a statement made bona fide in good faith upon any subject matter by a doctor to the concerned authority due to a duty to protect the interest of the community or the state. Okay, so here in this definition it is saying that if as we have studied in state related to state medicine, right? In state medicine, the doctor should inform the about the community health or any communicable diseases to the authority, which will protect the interest of community, right? So here how privileged communication says that how it should be informed. So privileged communication is nothing but the statement, okay, which is bona fide upon any subject by a doctor to the concerned authority to protect the interest of a community. So this is the method of informing to the authority about any communicable disease or anything which endangers the life of a whole community, right? So there are some professional secrets of a doctor. Disclosure of professional secret is justified under the following circumstances. So it means that after accepting to treat a patient, the doctor must not reveal the details of the patient to another doctor, also to anyone, because it is the privacy of a patient. Okay, so if we want to publish it in a research work also, the doctor should take permission of the patient. This is the basic right of a patient. But here in this case, as there is a matter of whole community health, so there are certain circumstances under which it is justifiable. So first is when it is required in a court of law, first thing. Second, when the doctor is directed by a judge to do so, same. When the doctor has a moral or social duty to perform, when it is necessary to safeguard the doctor's own interest, when a doctor acts as a citizen to ensure the responsibility of a person who has committed a serious crime, then in certain other exceptional cases permitted by law. So these are the few conditions. We will understand it by a example. Okay, so the example is a case. A VD, venereal disease specialist, saw a young man suffering from syphilis who was about to enter a public bath. Okay, so the specialist tried to stop the person from entering the bath, but the physician informed the patient refuses to do so. So here the physician informed the bath authorities and prevented the young man from bathing. The patient filed a suit against the doctor for breach of professional confidence, but here the court dismissed the case on the ground that the doctor acted in the interest of the community. So it is the best example to understand the privileged communication. In short, एक वीडी जिसको एक वीडी स्पेशलिस्ट है स्टोरी में, एक पेशेंट है जिसको सिफिलिस हुआ, और एक वो बाथ अथॉरिटी का हेड है. ओके, so here that it is a story of three persons. So the syphilis patient wants to enter the public bath, right? But the VD specialist or the doctor of that syphilis patient saw him and wants to stop him, because if he enters then the whole water will be contaminated and many will suffer with this dangerous disease, okay, called syphilis. So the specialist stopped him to do so, but the patient refuses. So out of concern to the community, the physician has to inform it regarding the patient to the bath authorities and prevented the young man from bathing. This is simple. But here the patient filed a suit against the doctor as he reveals his illness. Okay, but here the case turns the table down. The court dismissed the case on the ground that the doctor acted in the interest of our community. Okay, so here you have understood, right? Now our second uh, subtopic is duties of a patient. Okay, so here till now we are talking about the duties of a doctor, that what he has to do and what not to. From here we will in this topic we will learn regarding the duties of a patient also. First is furnishing information. The patient should furnish the doctor with complete information regarding past illness, family history, habits and addiction, fact and circumstances of the present illness. So it is said that the patient should reveal all about everything to the doctor, like past illness, family history, there is any specific habits or addiction, or facts and circumstances of the present illness, right? Second is following instruction. The patient should strictly follow the instructions of the doctor regarding diet, medicines, mode of life and investigations, right? After that, payment. The patient should pay a reasonable fees to the doctor. Privileges and right of a patient. Okay, payment work. Now there are certain privileges and rights of a patient here. Okay, the first is choice, right to choose his or her own doctor freely. The patient has the right to choose the doctor on its own access. First is access, second is access. First is choice, second is access. So access to right to healthcare facilities available regardless of age, sex, religion and social status. The patient has the right to take all the healthcare facilities which he needed at that point, regardless of his age, sex, religion, social status. Okay, third is dignity. Right to be treated with care, respect and dignity without any discrimination. And it is the duty of doctor also to treat the patient with utmost respect, dignity without any discrimination. Okay, fourth is confidentiality. All information about the patient's illness should remain confidential, but here there is an exception in privileged communication, right? Now, fifth question is information. Try to receive full information about the diagnosis, investigation, treatment plan, and alternative methods of treatment. So, it is also a duty of doctor to explain everything to the patient about the diagnosis, investigation, treatment, and any if there is any alternative method, the doctor should say. Okay, now sixth is safety. Try to know about safety of procedure, diagnostic procedures, complication and side effect. 7. Refusal. Try to consent to or refuse any specific treatment or all treatment. Okay, now continuity. Try to receive continuous care and attention from the physician or institution. Ninth is comfort. Right to be treated with comfort during illness and follow up. Last is compensation. Right to obtain compensation for medical injuries or negligence. So, in I guess you understand it completely. If not, just put a comment. Okay, I will keep improving myself. So yeah, thank you so much, and if you understand it properly, then do subscribe and share this channel. Thank you.